Hi there, Unite for Our Community. Sue Weldon here, and we are back with an update on our Ask the Experts. If you were with us, I think it was about 3 weeks ago, Lena, that we had you on. Dr. Linna Li, she's the System Division Chief of Radiology Oncology at Mainline Health, and she really answered so many questions about the COVID vaccine, and especially the ones that our women in our community have. It is so front of mind. We talk about this all the time. The questions were awesome, really relevant. And now in the news, we just heard something new come out, Dr. Li, just another type of just a bit of information on screenings and breast cancer screenings and the COVID-19 vaccination and how to actually go about that. So we felt like we wanted to get in front of it, have you on again, answer those questions. So I'm going to let you, talk about, the different circumstances when you're going in for getting your screening.
Yeah. So this is coming from the Society for Breast Imaging. And there was a lot of thought that was placed into it. Personally, I had both of my vaccines through Moderna. And after the second one, and I had it on my left arm, I definitely was able to feel lymph nodes about 2 days later. And the first thing I thought about was, oh my goodness, what about all of our breast cancer survivors? And what if you get a mammogram and the imaging is capturing that? So to backtrack, when we typically get vaccines, whether it's the flu shot or whether it's shingles or mumps or rubella, our body normally reacts by activating our immune system. And since our lymph nodes are part of our immune system, they can enlarge, and that's normal. So what we found with the COVID vaccine is that both of them, both Moderna and Pfizer, had a much higher rate of patients feeling lymph nodes either on the side that either on the neck or their armpit, on the side that they had the vaccine. And that's normal, and that's what we expect after a vaccine. And the rate was pretty high. It was up to 11% in the Moderna clinical trials. So that brings up an issue when women are asked to schedule their mammograms anytime, especially, let's say, within a few days after their first or second vaccine. What happens when you typically get a mammogram and the radiologists see enlarged lymph nodes is that you would be called back for all these tests to make sure that it's not breast cancer. So what the Society for Breast Imaging is now recommending, and what Mainline Health and many of the local hospital systems are recommending, is that if you are scheduling a screening mammogram, so basically anyone over 40 getting their typical screening mammograms, or breast cancer survivors that are 2 or 3 or 4 years out and their doctors had prescribed them their screening mammogram, that if you are timing it with the vaccine and you have a vaccine scheduled, ideally the timing of the mammogram should be before the first vaccine or 4 to 6 weeks after the second vaccine. So there's roughly a 1.5 to 2 month gap around the vaccine that you should not get your mammogram, so that we're not inadvertently having everyone worry about lymph nodes seen on the mammogram. Yeah. So it's a little bit different than a diagnostic mammogram. We order diagnostic mammograms usually 1 to 2 years after someone is done with their breast cancer treatment. And we would ask that you just get that on the normal time frame. And this is also different if someone, let's say, this has nothing to do with the vaccines, and you feel a lump or something doesn't seem right, and your doctor had ordered a diagnostic mammogram to check something out. In that case, you would just go ahead and get that mammogram.
Okay. All righty. I see Sophia. She was just saying all good information, and I appreciate that, Lena, for you coming on. And it's just sometimes it's not clear, and it can be stressful when we go in and get these diagnostic tests, and then you have, some other side effects that sort of come from that. So we appreciate you explaining that. I know there's a question that came through. It says, does having chemo and radiation affect the vaccine effectiveness?
So right now, and Unite for Her also joined ASCO and all these cancer-related societies. What we have found during the last year of COVID pandemic is that, unfortunately, cancer patients who are actively getting treatment, including breast cancer patients, including patients undergoing radiation and chemo, if they were to get COVID, the probability of having a much more severe disease, having to go into the hospital, having to go to ICU, and possibly dying from COVID is higher than the general population. So our priority right now is actually to get our cancer patients vaccinated. And as of this week, Mainline Health has prioritized cancer patients within the 70 and older category, because it's so important to get that vaccine and that immunity for our cancer patients. So all of us are saying, as early as you can, if you have breast cancer diagnosis and are currently undergoing chemotherapy or radiation therapy, wherever you can and as soon as you can, get the vaccine.
Good.
I don't know if that answered Sophia's question about the effectiveness and of chemo and radiation.
Yeah. Yeah, well, I'm not quite sure, but you're saying, the vaccine doesn't affect the actual treatment itself. It's just that if you got COVID, then you could just be more susceptible to have more of a serious case, because you are undergoing treatment.
Exactly.
Yeah.
And, historically, we say to just hold off on some of these live vaccines, and the COVID vaccine is not a live vaccine. And your immune system, whatever it is, even if it's not at 100%, even at 90%, it's still trainable. So it's much, much, much more important for the vaccines, for the cancer patients to get vaccines first.
Okay. Dr. Li, there was another question here, actually too. I've been diagnosed with metastatic breast cancer and I'm undergoing chemo, and is it safe to have the vaccine? So we answered that before. Absolutely. Yep. And then one other one was, I had my mastectomy scheduled for March the 1st and my COVID vaccine scheduled for 2/24. Is this okay? And would you agree?
Absolutely. Yes.
Oh, good. Yeah. Yeah. Well, good. And please keep the questions coming. We will watch this chat. We will have this broadcasted on our Facebook stream. We were answering questions all week, Linna, last time we did this, and you were so responsive. We thank you for that. Our community thanks you, because like we said, it's front of mind. It's all we're thinking about. I know for me, I'm going to be 17 years out coming up, and I'm on the list, but I'm way, way down. So I'm just sort of waiting for it to be called and signed up everywhere I could. Yeah,
exactly. And we'll get there. There's definitely going to be enough vaccines. It's just a matter of being a little bit patient, and in the next few months, because of these newer strains that are more contagious, to be vigilant about wearing your mask, washing your hands, and keeping social distance. So that's still really, really important until we can get the whole population vaccinated.
Yeah.
So,
yeah. Terrific. Well, thank you, Dr. Li. We appreciate you joining us today. You have a snow day. Your kids are home. I see them, a little different. A lot of kids are home now, but yours actually get to go to school, and they have a fun snow day today. So enjoy them. Yep.
Thank you. And everyone be safe. The roads are not
great. I know they're not great. We do this Ask the Experts every month. So next week, we're actually going to be doing an Ask the Experts on sexual health. So feel free to join us. We'll do another segment. And Dr. Li, again, thank you for joining us. Have a good day, everyone.
You too. Be safe.
All righty. Bye-bye.
Bye.